guys, welcome to a brand new episode of the Films Weekly podcast. I'm going to make sure that this is short and sweet so we can jump right on into this episode where I'm joined by Alex Martinez. Alex is the co-founder and CEO of a pharmaceutical company called Intrinsic Medicine. I know we hear the word pharmaceuticals and kind of go, ew. I promise you're going to want to watch this episode. We talk about how he's transforming the way we treat Parkinson's disease, Alzheimer's, IBS, and other gut-related diseases like Crohn's through the use of human milk biology. This is really, really interesting, especially if you've seen a lot of things going around using like colostrum. You're going to want to listen to this episode. So let's just jump right on in and let me know what you think. But make sure that you like and subscribe to the channel. Thanks, guys. Well, first off, I would love to know, Alex, from your point of view, because I know that you were an entrepreneur before, you went to law school. So what got you into the pharmaceutical side of things?
Yeah, so really, at my core, I'm a public health guy, right? That's kind of what I studied in undergrad. It's really kind of like where my interests always lied. And, as I went to law school to be a healthcare attorney, yet I realized, and I started practicing, like clerking in a health system. And I realized what I was doing was actually just perpetuating the dysfunction of an already broken system. And so that's kind of what got me interested in entrepreneurship. I wanted to be really on the solution side. Took me out to Silicon Valley. I helped to finance a number of different, healthcare companies. And then I realized that that also was, a fairly ancillary, effort. And I wanted to kind of dive right in and actually be on the innovation side. And I really sort of recognize that pharma is an industry that, quite frankly, needs to change. I think it's sick in and of itself.
Right. In fact, even when I had you on here, I was writing pharma down, and you just hate even writing it out, right?
Yeah.
That's
It feels
such
like
a bad association nowadays.
Yeah. And so, if you want to change a system, this is what my legal background taught me. If you want to change a system, you got to learn the rules. You got to learn the different dynamics. You need to understand the different stakeholder alignments. And, one of the really neat things about now is you have pharma companies that are petrified of the Inflation Reduction Act, and I welcome it because I would love to figure out a way to not bankrupt social welfare systems while delivering something of new and transformative value to patients.
Do you feel like the pharma industry is kind of the first place that we need to look towards fixing in terms of just healthcare in America?
Yeah, absolutely. Because when you look at pharma, it sort of rebuts the solo residual, right? Technology is supposed to get cheaper, right? As our computing power goes up. So how in the past decade has, getting a FDA approved drug to the finish line has now $3 billion when it was $1 billion, a long time ago. And you say, so there is a clear dysfunction in R&D. And it's not yielding improvements in lifespan or even health span, right? I think
I just saw an article, actually, I read it last night, saying that the lifespan is going down, and that the gap between men and women has actually even like widened more just in the past 4 years.
Exactly. So you're absolutely right. The same article I saw, and I'm like looking, I'm like, this is happening on a population-wide level. We're not delivering on the promise. And then, here's a great fact that you may have encountered, but last year, the median price of a new FDA approved drug, how much was it? It was $227,000. And what's paradoxical here is you think about there's an access issue. You think about the stress that puts on, out of, insurance beneficiary pools, out of public welfare programs. But then everything we know on the leading edge is like the mind and the body are connected. They're interdependent. There's a system. And so there's a concept of financial toxicity on top of the biological toxicity of some of these agents that we have to consider, because you have people that are saying like, I'm going to mortgage my future. My kids will receive nothing for an extra few months in some cases of life. And so I think there's a really important intervention point. I feel like the industry has lost its way, and
And unfortunately, the people that are getting so sick in our system are the ones that don't necessarily have the financial means to be able to get the medicine. So then when people are wondering why is our lifespan going down, it's because people can't afford the healthcare options that we have available to us.
Exactly. And so, yeah, what we're doing is we're creating a truly segregated healthcare system where,
Right.
you know, if you have the means, you have cutting edge therapies, you have cell therapies, you can have new brain cells implanted in yourself.
Right.
But, and that's right. Those are probably the largest cohort. Those are the only Parkinson's drugs that are moving forward, are literally genetically engineered stem cells to be implanted in your brain. But then there's going to be a whole class of people that probably can't even afford levodopa, a generic mainstay that's already half a century old and has its own side effects and limitations. But yeah.
So tell me a little bit about the intrinsic medicine. I went to your website, and I'm going to be completely honest. When I do a podcast, I try to deep dive and figure out everything about the past and the brand and everything that I can. And I went and I was like, even me, I was a biology major. I was pre-med. I was a medical assistant. I've been a personal trainer for 20 years. I am a certified nutrition coach. And I was like, what the heck is this science? I know what oligosaccharides are. They're long chained carbohydrates, long chain sugars. But aside from that, I'm like, I need to know, what is all of this? So
Okay.
tell me a little bit about the business and how you got into it, and how is it going to kind of change, or how can it change Parkinson's and Alzheimer's? And I know that's a lot of loaded questions.
Oh, that's wonderful. I'm very excited to share it with you. And so I really kind of learned the pharma biotech industry at a company called Ionis Pharmaceuticals that was developing mRNA, targeting genetic medicines for, very small patient populations.
And for those people that don't know what mRNA, messenger RNA, can you kind of quickly give an easy synopsis of that?
Yeah, absolutely. So, our DNA is kind of like the information library. And when it wants to kind of functionalize some of that information into our life, it really kind of creates kind of a recipe called mRNA that goes to a factory that then produces the protein that's going to be biologically active and will change, our body or how it responds to, environmental or internal stimuli.
Exactly.
Was that a reasonable?
Yeah. From when I was 20. Yeah.
Perfect. And so sometimes people that have genetic um, diseases, they're producing kind of the wrong recipe, and it results in a protein that maybe doesn't function correctly or can actually hurt the body. And so what you try to do is either stop that recipe from reaching the factory or you correct it. And so it's a very special approach, but the way you do that creates its own host of problems, both delivery and side effects, which can often be serious. And so therefore, the risk benefit is really only in people that have what's called a monogenic. So it's like a single mutation that leads to usually a fatal disease. And that's where that class of drugs kind of has, the appropriate risk benefit. And so while I was working there, I said, wow, all of pharma is putting their R&D into these rare diseases. And this is certainly not to diminish any patient that has a rare disease. But then I said, what about the rest of us, where it's not a single mutation? And I didn't see anyone developing drugs that I would deem to be anywhere near transformative for the things that I have, a patient myself, or that, my kid might, or my wife might have. And so I realized what was inhibiting pharma from going there was safety. And all of the modalities that were being used just did not have safety profile that supported a large research and development expenditure in kind of a non, genetic mutation population where people would definitely die, and usually, very prematurely from it. And so I said, if I can find new drugs that are absolutely safe, and that's my first screening parameter, then I can meet the market need and gap, which is the rest of us.
Sure.
And, when I looked at all the different disorders that I felt were not being served, I said, what's common about them? Immune dysregulation and dysbiosis of the microbiome. I think we're moving, and you're on the probably on the leading edge of thinking about this as well, that all
And
these
gut health is tied to everything.
everything.
Yeah.
We
Even
might
our
just
thoughts.
precisely. So what all these chronic diseases might be is just different manifestations of the same core dysregulation of the microbiome and correspondingly the immune system. And so then I was like, okay, safety's primary, because safety also changes drug development, and I'll tell you how we've done that. And so then I said, okay, well, where am I going to find these glorious molecules? How do I find them? Okay, so I created a thesis, and then I said, well, the lens I'm going to look to find them is going to be evolutionary biology. So let me look at unique junctures in human development, and let me try to find molecules that appear there in early life, in infancy, that appear nowhere else.
So like stem cells, for one example, for people kind of like, we always automatically know like stem cells, babies. Obviously, I know we're talking about micronutrients and stuff, but in terms of like what things change, just to make it easy and kind of give an idea for those listening that might not quite understand, like the equivalent of a stem cell.
Exactly. So we look for compounds that appear in the human body in early life that don't appear anywhere else, and then we start to say, well, how do we understand these things? What is their adaptive? What did evolution select and conserve them for? And so I came across, these compounds in an infant nutrition lab.
Okay.
And what was unique about them is, so these compounds are called human milk oligosaccharides. So as you said, they're carbohydrates, they're sugars. And why are sugars in human milk? And these are actually the third largest solid component in human milk. There's 5 to 15 grams per liter in human milk. And above that is fat and lactose.
Oh, wow. So not even protein.
Yes, exactly. So these are in a very high concentration, but what's very interesting about this, they're amylase resistant. So amylase.
So again, amylase is an enzyme in our mouth that automatically, when we eat sugar, amylase starts to break it down right upon digestion.
Exactly.
Right. Okay.
Yep.
Bring it back. See, I still got some chemistry from 20 years ago.
Yeah, you got it. And then you'll understand the aha moment, which is these things are non-caloric. Wait, what's happening here?
Yeah,
You have
four calories per gram is a carbohydrate.
Yeah, so wait a second. These are non-nutritional. What are they doing here? And why are there over 200 distinct structures that each are appearing to have their own biological function? And to add further intrigue, I was also looking at the context in which they appeared. So while it started, I'm looking in human milk and I say, wait, these are non-nutritional. What do they do? I also saw that they appeared in the serum of pregnant women starting in the first trimester.
Is it also found in colostrum?
So it's found in colostrum. Colostrum has an even higher concentration, but what's really an interesting finding is, why are these appearing in the blood of the moms early on in pregnancy and continuing? And then they were found also in fetal cord blood. So they're circulating systemically in the infant as well. And they're surrounding the infant in the amniotic fluid throughout gestation. So what's going on here? And there was this kind of intriguing insight, which there's been something that's observed, and maybe you've encountered this before, is that often women who have like an autoimmune disease like rheumatoid arthritis, of course they're not going to be on any of those dangerous drugs during their pregnancy, but they go into remission spontaneously.
Yeah. I mean, Crohn's disease, colitis, a lot of issues.
Exactly. And those observations of remission correspond to when these human milk oligosaccharides start entering the blood of moms. And then there was another epidemiology. So it's like looking at, pregnant women, including those with rheumatoid arthritis, and them having a higher level of just a single one of these compounds that we know is responsible for the majority of the anti-inflammatory effects was like associated with like a insanely high p-value. So very high. That was at 0.002 or something like that with remission.
Wow.
So all of a sudden I had this human snapshot and I'm like, those are not nutritional compounds. They appear in the blood. They correspond to remission. And then some scientists put them into different models. That one that showed that signal, put it into multiple models of rheumatoid arthritis in animals, and it worked. And it worked just as well as methotrexate, which is like the highly immunosuppressive, toxic, repurposed chemotherapy agent that's still a mainstay of rheumatoid arthritis treatments. And so I was like, wow.
Has this never been studied before? Like, why are we just not hearing about this? And I feel like colostrum has really just also gotten like a big, it's kind of like the new drug kind of, or the new supplement that you see going around, which is great, obviously, from what you're saying. But is this like a new finding all of a sudden?
So yeah, these findings started emerging in around 2018-ish.
Okay.
But I think what happens is you have a very interesting dynamic where there have actually been manufacturers of these compounds really who focus on like kind of food ingredients, or they spend like over $1 billion and several decades developing synthetic biology in order to produce human identical milk oligosaccharides at lot scales that are large enough to be cost effectively included in infant formula. And so really what you have is a circumstance where kind of the wrong industry was looking at the right compounds. And that industry actually has a disincentive to characterize these compounds for their full biological properties, because they want to say like, no, it's just for infant formula. Don't look here.
There was never that connection of like, why do babies need this so much, and how could it actually help us as we get older?
Exactly. The focus is really more on just the gut microbiome. And I mean, there's some amazing clinical studies in infants. Just, there's, I think, three of these 200 that are approved for inclusion. And in human infants, these things can reduce inflammation like 70% just by including it into a formula. So it actually argues that formula without these is actually pro-inflammatory compared to breast milk. And then just including one of these is capable of reducing that inflammation back to the same levels as a completely breastfed infant, which is a striking finding. And I think the industry may have even seen that and said, we want to get these to market. We don't want the FDA to say like, hey, these are extremely biologically active. Do you know everything about them?
Wow. So then what made you start looking at it from a side? Like, I kind of get the systematic view of gut issues or inflammation, but then you're talking about more neurological diseases like Alzheimer's, Parkinson's disease, where the brain blood barrier is. And so what kind of connection did you make where you could actually benefit the neurological side of things as well?
Absolutely. So great question. And, really we've been focusing on the gut brain axis, right? Which is that, our gut has its own nervous system, and via both indirect pathways, but also directly through the vagus nerve, it connects to a brain and our central nervous system. And this is a bidirectional system as well. And so there's just been an absolute kind of avalanche of data showing that this system is implicated in a variety of diseases. And by virtue of me really looking at this entire class of compounds, I also had some really interesting animal data. And part of it's from the human experience, where you can actually look at levels of these compounds, and you can see that, for example, my lead compound is independently associated. So moms that have higher levels of it in their milk, their infants have better executive function. They have literally different neurological function. And then, others have done reverse translational experiments to say, what is this about?
Mm-hmm.
and given this to mice and shown that it actually improves their executive function as well. And one of the neat things about sort of the interplay between the human milk biology and mouse biology is my three most advanced compounds are common to both human and mouse milk.
Oh,
So
wow.
so that's what also encourages me that I'm going to be able to translate this into the clinic.
Mm-hmm.
And so going back to that experiment, so the mice given 2FL had higher executive function, and then they severed the vagus nerve, and lo and behold, it stopped. So it actually shows that this works through a gut-mediated perspective. And then we also looked at it directly interfacing with gut neurons and showing, independent of the microbiome, these compounds actually can modulate gut neurons. So we know that there's a direct signaling pathway straight to the brain. And then, for example, with Parkinson's, what's fascinating is that it's been noted that people with Parkinson's, they have constipation, and up to 80% of patients are constipated, and it actually precedes the neurological and the motor symptomology. And so this really led to something called Brock's hypothesis, which was looking at the microbiomes of people with Parkinson's, and both the oral and nasal as well as the gut microbiome are markedly different. So the thought is that maybe the pathological process actually initiates in the gut.
Gotcha.
And that was tested in an absolute landmark study published in late August of this year in Gut BMJ. So that's the GI publication of the British Medical Journal. Is kind of the equivalent of our New England Journal of Medicine here. Mm-hmm. And they looked at almost 25,000 people with Parkinson's, and they assessed it based on exposure of previous history of gut symptoms, including irritable bowel syndrome.
Oh, wow.
And
okay.
lo and
so
behold,
people with, well, I won't spoil it. Go ahead. Yeah. I was just gonna say, so people with gut issues earlier on in their lives have a higher risk of developing Parkinson's as they get older.
Yeah, and it's a stunning increase. It is people that had a history of constipation dominant irritable bowel syndrome mm-hmm. had over 4 times the odds of developing Parkinson's.
Wow.
It is enormous.
Wow.
And so this is an epidemiological study it's on par with the size of the LDL ones that mm-hmm. set the risk thresholds for mm-hmm. Cholesterol levels. Mm-hmm. And to see an odds ratio as well as relative risk ratios that were like 3.3, so that's like mm-hmm. over 300% increased risk is stunning.
So then my question becomes, is gut issues early on a pre-symptom of what could develop into Parkinson's, or is gut issues at a younger age the cause of Parkinson's later on?
Yeah, that's where interventional testing is important. Because also the last thing we would ever want to do is, given how many people have gut issues, is to mm-hmm. create fear around that.
Right.
And so there are papers that really lay out what the pathophysiology would look like, mm-hmm. which essentially what it would look like is that if you have gut issues that lead to gut inflammation as well as a leaky gut, so gut permeate, a lot of people have heard about that. So, so a lot of other toxins and maybe even bacteria can transfer and can enter through the gut and kind of perpetuate that local inflammatory response. That GI inflammation can trigger the sort of pathological production of alpha-synuclein, which is the protein that eventually we find in the brains of people with Parkinson's. And where this mechanism seems to occur is that you can find that alpha-synuclein in the gut neurons first and early on. So what that seems to suggest is that sort of gut dysfunction can trigger this. And then once that alpha-synuclein is, so it's almost kind of an amplification, because then you have that in your gut neurons, and it's only going to make your GI symptoms even worse.
Right.
And then that alpha-synuclein, that protein that's been triggered by those gut effects, can travel up the vagus nerve, where then it can enter the brain and start to aggregate there, triggering brain inflammation and destruction.
Decreased dopamine and all that.
Precisely.
Yeah. And when you and I first started, I'm just listening to this. And again, when we first started chit-chatting, which I'll probably delete from the very beginning of the podcast, but I mentioned that somebody in my family suffered with Parkinson's from a very young age up until he passed away. He died at 69. And just kind of going through, I don't know if there's ever, and maybe you'll know the answer to this, has there been a gene that's been linked to Parkinson's to be able to pass down? Because what I'm thinking when you are telling me this is that another family member has suffered with terrible constipation, where going to the bathroom once a month is like a hand clapping event. And so from just going from my family history, I'm going, wow, this is very, very interesting to me. I'm going to make sure now to pass this episode on so that this person can do a little bit more research for themselves.
Yeah, absolutely. And so there have been several genes that have been associated with Parkinson's, and certainly there's some familial Parkinson's but it's really the genes that kind of create this risk, because we also see them across both the familial ones, but also the sporadic Parkinson's. And so that's kind of where we need to understand what do these genes actually do, and a lot of them are linked to the immune regulation, right? And those are the ones that we want to tease out, because maybe they make people more sensitive to this. So maybe it's not everyone with a GI issue is directly converting to Parkinson's.
Right.
There's a subset of those people that, by virtue of their genetics, are more likely to trigger this kind of amplification cascade that then does lead to it. And that might be, because at this point, Parkinson's is defined based on clinical symptoms.
Right.
And really, it's only for the first time ever that, I think Michael J. Fox Foundation earlier this year published an assay to measure alpha-synuclein in the cerebrospinal fluid. But that's really still a long way from us having a confirmed diagnostic early on. So I think that's work that we certainly hope to elucidate. And like, that's why now our goal is to run an interventional study with our, human identical milk oligosaccharide drug candidate, and then against a placebo in Parkinson's patients with constipation. And then we're going to do full multi-omics on them. And so what that means is we're going to look at their gut microbiomes, their oral microbiomes, changes in that. We're going to look at all the proteins in their blood. And really what we're going to then try to do is, identify, the responders from the non-responders, and figure out if they have unique biology, so that then we can really help to stratify the patients and identify the patients we can help. And then for the patients that maybe that intervention didn't work for, we'll figure out what's different about them, so that we could then find a rational drug to serve those people. And that's kind of the way we envision this.
The power of your drug and using the human milk oligosaccharides. I know, I'm sorry, there were like two more words in there, but just going from memory, do you see this power as being something that could be preventative towards going into Parkinson's, or more of a symptom control mechanism as they are diagnosed and going through?
It's a excellent question. And so for the initial study, it is powered to detect, improvements in the constipation, non-motor and motor symptoms, and also cognition, right? Because if we see any signal that we're slowing those down and, kind of moderate Parkinson's patients, that will then inform how we, enter into a more preventative paradigm, right? Because that's ultimately what we want to be able to do, is how do we identify these patients as early as possible, because that's always going to be the intervention point for maybe stopping or even reversing the disease.
And for anything, early diagnosis, right?
Exactly. You have to get there. And I think that's what's very special about these compounds, right? That's why, like, safety, safety, safety. I wake up thinking about safety and I go to bed thinking about safety, and how we can leverage it to help people sooner and better. Sure. And with these GI symptoms, so often preceding Parkinson's, these are functional risk factors. There are risk factors like, I was getting ready to run an IBS constipation study based on extremely compelling open label data with these compounds. And so that by itself is something that we can get a drug approved for. So imagine if we can treat people with the functional risk factor, make their life better today, right? Because having IBS-C is not a fun experience. And we know that it prevents them from getting that.
Sure. So would you feel like, because you said there are 0 side effects and colostrum is becoming a little bit more available, I really feel like even just in the past 5 months, I've been hearing more about it, that people should just start taking it kind of as a preventative measure, kind of at the same time, like creatine has really gotten a spotlight for not just, the muscle bros, for everybody can benefit from taking creatine every day. And there's 0 side effects as that as well. Do you see that as being like a supplement that people should and could partake in?
Well, it's interesting because I'm certainly not a healthcare professional at all, and
right. This is me just like throwing ideas away. Like,
so I think it's an important idea, because what I'm really excited about is the self-care movement and like self-directed preventative paradigms, and the way I always talk about it is the science is overwhelmingly clear. Gut health is human health. So if anyone is not satisfied with their gut health, and we all have a simple but crude diagnostic tool, which is turn around and look in the toilet and use the Bristol stool form scale,
right?
see where you are, develop the body awareness, around certain foods to say, hey, do you feel bloated? Do you feel low energy? Do you feel high energy after having it? And then you have that metric is optimize your gut health, and your overall health will improve. And so I think, compounds that are rational, like a colostrum, or even just, one of the things I always go out and tell everyone is 95% of US adults are not at their dietary fiber goals. Yeah. So optimize that and see what improves in your life. And my goal with Intrinsic is, we're a patient solutions company. And so that may include information, because I want people, coming to our studies that are already maxed out on what they could do in their own lifestyle, via their own diet, via their own exercise. And then I have, a population of people to add incremental value and benefit to with my products. So
I love that you're in the pharmaceutical business, but you're also promoting, like, what else can you do in your lifestyle to create a healthier life for you in the long run, versus just take this pill.
Exactly. I don't want people to wait 20 years until it's so bad that they go in for a script and it's like, okay, this will delay the inevitable for, a short period of time. And that's what's unfortunately happened with neurological diseases. And it's quite frankly, like, what's killed a lot of the late stage development programs, is at the time the brain is so destroyed,
right,
that you're
so
like,
there's no coming back from it.
Exactly.
Do you listen to Joe Rogan at all?
I do, yeah.
I just feel like I feel like I was just meant to talk to you this week, between reading that article last night, and then my husband had just listened to a recent episode of Joe Rogan. I was trying to find out who it was. And he was basically supporting everything that you've said, that a lot of diseases that we suffer from as we get older are from a nutrient deficiency from our gut. And he talks a lot about, I know, like fluoride in the water and touching grass every day, the simple things that you can do, but it really does all come down to nutrition at the end of it all.
Yeah, it's nutrition. And I think the environmental exposure is also a really, really important one, because one of the lenses that I look at all these problems in is that our culture has kind of leapfrogged our biology, right? And it's sterile environments, right? It's why autoimmune diseases are, skyrocketing. It's because our system recognizing self and non-self, that's all environmentally trained, right? When we were in an environment where there are microbes everywhere, and our immune system has to say, okay, that's a friend, that's a foe, we're neutral to that guy. And we've literally lost that ability. And now our own cells are being viewed sometimes as the bad guys. Same thing, like you see like C-section births, like it's very clear that those babies have a different trajectory because they have different microbiomes, because it's from coming through the birth canal that you get seeded with your foundational microbiome. Same thing.
This is just a joke, you guys, but I blame my mom all the time because I was a C-section baby. I'm like, everything that I have wrong with me is your fault.
I know, I was a C-section baby as well. But luckily breastfed, or I think my trajectory might have been even, more amplified. And so really getting back to nature is important. Eating healthy whole foods that you can recognize, having prebiotics are proving to be unbelievably powerful, and that's a low-hanging opportunity. It's like, get to your dietary fiber goal, and your life will change.
It's really not that hard to get 20 to 25 grams of fiber a day. For sure. Yeah. If you are interested, if you haven't listened to it yet, it's Gary Brecka. Highly recommend it. It was his episode number 2060.
Thank you for that.
Yeah, absolutely. I think that you would really enjoy that one. And I know that we're coming up on time, but what is the next step for Intrinsic? What is it? Are human studies going to be coming about? What can kind of people expect from you?
Yeah, absolutely. So the great thing with the safe compounds is what we've been able to demonstrate is that we can go, directly into phase 2 human studies.
Nice.
And so
that's very hard to do otherwise.
And what I'm proud of, so for example, that landmark paper in August, which kind of really supports the testing interventionally a gut targeting drug for Parkinson's. We have already been approved by Australian regulators to begin dosing Parkinson's patients in a placebo-controlled phase 2 study as of October. So 3 months after that study, we're literally able to go into a phase 2 program, where a typical pharmaceutical company would say, oh, this is very interesting. Maybe in 5 years we'll enter a phase 1 safety study. And so that's really the next step, is to run that program, identify the signals, and then really figure out a way to expand and do late stage clinical development, including in the US and the Europe, so that then patients can have an opportunity to participate.
Is it pill form? Is it syringe? What is the medicine?
Oh yeah, so the medicine is it's a 10-gram sachet of a powder.
Okay. Easy peasy.
Super easy. Like, you literally can mix it into water. It dissolves readily. It actually tastes good. It's like probably the only drug in the world that tastes pretty good. And yeah, they're really special compounds. And our goal is to bring them forward, to do the right science on them, so that we can fully elucidate who they can benefit and how to maximize that benefit. And then I think the other important thing that we're committed to is for these to be accessible via price point. And so we've worked with synthetic biology manufacturers, and we know that, if the drug works and, we get it approved, that we can commercialize it at a price point that everyone can afford.
2 questions on that. How long do you feel like participants will have to take how many doses before they'll say like, yes, I'm starting to feel a difference, or this is working for me? Is it after 1, 2 weeks, 3 weeks? And then is it an expensive drug to produce once it is going to go into manufacturing?
Yeah, it's a good question. So right now, it's daily dosing.
Mhm.
And there was an open label study that was run with these compounds in all subtypes of irritable bowel syndrome, including the constipation dominant form, and pretty significant improvements in all symptomology was seen as early as 4 weeks.
Wow.
So so
Mhm.
so at least on the gut side of things, we would hope that people would start to feel better at 4 weeks, and then the maximal effects were seen at 12 weeks.
Okay.
And what's a little bit different about our Parkinson's study is we are running both 13-week, and so that'll be the placebo controlled portion.
Mhm.
And then all the people that are on active drug are going to continue for another 13 weeks, all the way out to 26 weeks. And then, because it's important for us that people with Parkinson's who are, they're enrolling in the study in the hope of getting the drug,
Sure.
they're going to have opportunity to access that drug. So after that 13 weeks, then they're going to go into an open label where they get access to the drug
Mhm.
through for 26 weeks. And then it'll just give us a little bit of an extended data set that would be the longest these compounds have ever been tested in an adult human.
Wow, that's awesome. What is
And
the lifespan nowadays of a Parkinson's?
it's a good
Um,
question. I'm not sure. I think I think it's highly variable.
yeah, I
Uh,
think so too. Yeah, super sad. Well, like I said, I know that we are coming on time. I honestly had 0 notes written down because I was like, I don't really understand all of this. So thank you for breaking it down and just opening up so many different ideas and having such a good flowing conversation. I really could just pick your brain on this. I think it's such a cool topic, such a cool realm of science to go into. We live in an incredible time to be able to find these things, right? My worry is that with anything, people are going to find other ways to use a drug, kind of like Ozempic, for example. And then that's what takes other people away from being able to use it that actually need it, or that's what drives the prices. It's like, hey, well, this is so great for Alzheimer's and people with gut issues and Parkinson's, but then is it also going to help bodybuilders, like do something great? And then they're going to try to steal all of the product. But it sounds like it's going to be pretty easy to get for anybody.
Yeah, and I think just on that final note, I think what's important is that there is a path. There is a very reasonable path to harmonize the different
Mhm.
use cases. And by the way, this will work for
Yeah.
bodybuilding. I have some amazing genetic data that shows that it would be great. So there could be a supplement line, right? And then
Mhm.
people can just pay for it off the shelf. Meanwhile, for people with a prescription drug, I need to go through a very different process to
Mhm.
ensure absolute purity standards, because they do have gut permeability. Impurities are not appropriate in these more vulnerable populations. So I think there's a way that we can do a bifurcated approach so that
Mhm.
everyone who wants access can access it the right way.
Gotcha. So anyone listening that's as into this as I am, where can they find more information at? And for more information as it comes out, is it always going to be posted over on the website?
Yeah, it'll be posted on the website, and we're in a bit, busy in the middle of a revamp. But just sign up for my newsletter. I'm going to be pushing out content, including, as I said, eventually lifestyle content, right? Because I want to offer solutions,
Mhm.
before my drugs are available. So just feel free to sign up, join us on the journey, and I'll keep everyone informed.
Awesome. And that's at intrinsicmedicine.com.
Yes, it is.
Awesome. All right, you guys, you heard the man. Go over there, sign up for the newsletter, stay in touch. And anytime I see cool information too, I will make sure to drop the recent research to my lovely community.
Wonderful.
Awesome.
Awesome.
Thank you so much, Alex. That was great.